earliest recollection of being interested in medicine goes back to my childhood and my visits to my primary care doctor. The nurse in there, her name was Nurse Ann. She was the epitome of professionalism. Stark white uniform, great bedside manner. I watched her interact with people of all ages, and I remember saying to her at one point, "I want to be like you when I grow up." And she responded to me, "You can be anything you want to be and never forget that." And I did. I completed my undergraduate studies as a nurse and had the privilege of working in critical care for most of my career. I loved being a part of the team and feeling like I could really impact on someone's life. And then I got to the point where I knew I wanted to do more. I wanted to be more involved in medical decision making about my patients. So I obtained a master's degree in adult health and became board certified as a nurse practitioner. And for the past 20 years, I've worked in the specialties of cardiology and urology. I've been a hospitalist in a healthcare system. I have done visits to homebound and have worked in adult medicine and geriatrics. My job has many rewards. I get rewarded every day in some regard. I remember my professor, who went on to be a mentor for me, give me a really good piece of advice. And that was what she called the sleep quotient. And she said, "You want to go home at night and be able to put your head down on your pillow and know that you did the absolute best you could for every individual life you touched that day. And when I can go home at night and do that, that's the best reward." I welcome any and all questions I get from patients and families. I really enjoy that interaction. I like to share personal things and have them share personal aspects of their lives with me because it makes that relationship so much better. The one question that I enjoy answering the most and I welcome the most is, what is a nurse practitioner? Why should I choose a nurse practitioner to be my healthcare provider? And my response is the same. And I say, I am a nurse. I have my nursing experience and my education. I have many roles. I wear many hats. And I am able to combine that with the medical knowledge and education and experience that I've obtained over the past 20 years and help individualize your plan of care and work with you to improve your health outcomes. And I think that's what sets NP Care apart. And I'm very proud to represent all the nurse practitioners. I am nurse practitioner Rossetti. My mission at Jefferson is to improve lives.